continue with the lymphatic and immune system problem set. We finished up until question 7. And we're going to start with question number 14. I see Ian has his hands up, so we'll start with Ian for question 14.
Can you hear me? Yes.
Yeah. Yes, I
All
do.
right. All right. So all of the following are true of lymphocytes except, what did I put? D, they are granulocytes.
So all of the following are true of lymphocytes except, are they, except what? So except means are not, and you're saying they're not granulocyte, correct, right? So what are the granulocytes? Can you tell me, Ian, since you're here?
Yeah,
already?
they're the basophils, neutrophils, and eosinophils all
right.
are granular.
Excellent. And then lymphocytes are what?
Non-granular, along with the monocyte.
Excellent, right? Perfect. So D is the correct choice, right? They are, in fact, non-granulocytes. They do have some granules, but they're non-specific, but they're, categorized as non-granulocytes. So good. We're going to go with number 34 next. I have Andrew.
Lisi has a bad sore throat, and the lymph glands in her neck are swollen. This would indicate that I put E.
You put E. Lymph gland has increased its secretion of thymosin. Okay. So they are producing something, right? But the answer here would be, answer is C, right? So the affected lymph glands, they have increased number on lymphocytes. And that is essentially, right, as let's say you have a patient, you could also check their lymph glands on their neck, right, if you believe they have an infection. And as you know, right, lymphocytes especially are found in your lymphatic system. And when you have an infection, you have increased number of lymphocytes, so your glands will swell, right? Or, and that's why if you, let's say you go to a doctor, they will check your glands. You could check that on your patient, right, as you're palpating them. So if those glands are swollen, usually indicates increased number of lymphocytes, right? So C here is the correct choice. Okay. Next question we got Helmi for 45.
The body's non-specific defense include of all the following except the skin complement skin A.
Okay. So think about it. So when we talk about non-specific, right? So non-specific, and it says all of the following except means which of these is not non-specific. So another word for this question. Essentially, which of these is adaptive, right? Because all of these, the skin, the complement system, the interferon that fights viruses and inflammation, this would be non-specific, right?
B and T cells, yeah.
Yeah. So B and T cells, they are specific, right? And they're specific, and they produce that adaptive immune response. In the sense that they are the ones that are going to be looking at the antigen, making antibodies, so that antibody production is specific to the antigen, right? Where all of this skin, the complement system, the interferon against the viruses, then the first inflammatory response, those are non-specific, and they're the first ones to be activated, right, in order to fight infection or virus, right, or anything that's foreign that's coming into your body. So correct choice here is E. All right.
Hey, Nick,
yeah.
Can you just go over what is the complement system again?
So the complement system is usually like C3A, C3B, and what they are proteins, right, that come and they clump together, and they mark specific bacteria or foreign body for destruction. So let's say this is your bacterial cell. Bacterial that comes in, right? I should say bacteria. So initially, we'll try to phagocytize this, right, with like a neutrophil or a macrophage. And let's say, right, they haven't done the job fully, right? So then they start calling on additional systems to come and help us. And the complement system, right, it's basically a series of proteins that basically create pores. They'll come together and they will combine like C3A, C3B, and they'll come in and combine and they will create pores in this bacteria or this cell, like let's say a foreign cell that they determine is foreign. And the pores in the cell membrane is basically going to try to break the cell up, right? And these pores are created by the complement system. It's in addition to, right, your inflammation. It's in addition to your macrophages, the initial line. So this is calling an additional help. They can also mark the cell for others, like, you know, macrophage to come in and eat them up, or a specific antibodies to come in and then also attack it. So the complement system does that, right?
Thank you.
All right. So next question is 48. 48. We are going to Hira or Hira.
It's Hira. Yeah, you're right.
Here.
Okay. Examples of physical barriers against pathogens include all the following except, I think, blood.
Yes, correct. So the blood is not going to be a physical barrier, because the moment you get into the blood, you already bypass all the physical barriers, which all of these are, right? Sebaceous glands that produce mucus, mucus itself, epithelia like your skin, right? Epidermal layers, right? That's why we teach you guys to put on your PPE, put on your gloves, especially if you have like a cut on your fingers, right? You want to be cautious and always wash your hands after every patient contact, or at least use a hand sanitizer, right? But yeah, the moment it gets into the blood, you have bypassed all your physical barriers. Okay, good. 51, we're going to go next with, well, we're back to Ian.
Okay. The movement of phagocytes through the capillary wall, phagocytes, is called diapetes.
Diapedesis, yeah. So that's the movement, right? Of the phagocytes. Phagocytes are primarily being like your neutrophils, right? Your eosinophils and your macrophages. So when they move towards, right, whatever they're trying to engulf, yeah, the term is called diapedesis. Okay. 52, we're going to go with Andrew.
The attraction or repollution of certain cells to chemical in their environment is called
apoptosis. This means it's marking a cell for destruction, right? So
Okay.
the correct choice here is choice A, right? It's chemotaxis, and we see chemotaxis especially like in white blood cells, right? When they rush to an area of inflammation, right? So you're calling like neutrophils, macrophages, right? So chemotaxis is basically all these cytokines or chemicals in the environment, right? That are coming or they're being attracted. So chemotaxis, right? Maybe think like taxi, right? Taxis, right? They're coming all together. And apoptosis, this is usually cell destruction, right? So the correct choice here would be choice A. All right. 62, we're going to Hira.
All right. Oh, I cannot see it. An inflammatory response is triggered when I think it's E, blood flow.
Yeah, you could, but imagine if I have vasodilation and the blood flow to the area will increase, but does that in fact trigger inflammation? I could give you a medication that will dilate your blood vessels and there is more flow to the area, right? But does that necessarily mean there's inflammation?
I guess not.
So what do you think? Let me see. When you have like an allergic reaction, what is the major releaser that causes all this inflammatory responses?
Like the histamine?
Histamine, right? So which
Yeah.
one out of these
G.
do you think? Huh?
C, right? Mast
C.
cells release
Yeah.
histamine.
So mast cells is the cells that are going to be preloaded with IgE antibodies, right? And when they degranulate, right, they will release histamine. And histamine is what causes, right, all the effects like increased mucus production. It's going to cause bronchospasm. It's going to cause more permeability in your vessels. That's why we have a medication that is an antihistamine, specifically when you have an allergic reaction. Do you know what the medicine is? It's in your formulary for you, in your REMAC protocols for allergic anaphylactic reactions.
Benadryl.
Yeah, diphenhydramine, right? So it blocks histamine, and essentially, right, the histamine is what's causing all this response. Histamine also, mast cells also release heparin. Heparin is also going to cause, increased blood flow to the area. So good. So 62 is C. Next is we have Helmy for number 67.
Defense of the body against particular pathogen is provided by defense of the body against a particular specific immunity.
Excellent, right? B is correct. Specific immunity, right? Because when we have a particular pathogen that we're forming a specific antibody against it, right? So if we're forming specific antibody against it, that's going to be by specific immunity. It's going to be done by T and B cells. T cells are going to, especially T helper cells, are going to send cytokines on the B cells. B cells are going to become plasma cells, and then they're going to make more antibodies, which are very specific to that particular pathogen. So we call that specific immunity for number 67. So B is correct. 68, we are going to go back to Ian.
Immunity that is genetically determined and present at birth is called E, innate immunity.
Innate immunity is correct, right? So that's exactly right. Especially when the infant is born, right? They still have not developed all their immune systems, so they will rely on this innate immunity, right? Initially, that's why we also make sure, right? When the infants are born, they receive their vaccinations, right? Because they still do not have the ability to, form antibodies and have their immune system functioning at the highest level. Okay, 68 we have. Next, we are going to go to Hira for 74.
All right, the role of antigen-presenting cells in immunity is due to all of the following except D.
D, phagocytosis, correct. So the role of antigen-presenting cells in immunity, do all the following except phagocytosis is correct. Because antigen-presenting cell, so like let's say a macrophage, right? It's going to eat up that cell, and let's say it did not phagocytize it. It couldn't do it. So then it's going to express it on the cell surface. It's going to then take it to the T cell, activate the T cell, right? And then that will activate the B cell. So so the process would be, it tried to phagocytize, it didn't work. It processed the antigen, right? Display antigen fragments on the surface, take it to the T cell, and the active T cells are going to then activate the B cells. And so except phagocytosis. So very good. 76, we are going to go with Helmy.
Class 2, massive hematocrit value.
No, it's MHC is major histocompatibility complex. But for your purposes, just think class 2 molecule.
Class 2 molecule, okay. Are found only in which of the following? Which nucleus? Which red blood cells? I think that will be B, red blood cells.
So red blood cells
has no nucleus.
Yeah. So remember I was drawing a molecule when the macrophage expressed it on the surface. It took it to which cell? So when remember when I drew this? Let's say this was your macrophage. It tried to engulf. Let's say this was your pathogen. It engulfed the pathogen, but it didn't phagocytize it. Instead, what it did was it expressed this on the surface. Let's say this was the surface with type 2 molecule.
Take it to.
Where did it take this to?
Lymphocytes.
Yes,
and
lymphocytes.
Antigen.
Exactly.
Lymphocytes, yeah.
Remember, I was drawing this molecule, so I took it to a lymphocyte This was T cell receptor. So this comes here, right? This was CD4, and this binds here, right? So this is where it was binding. This was the T helper cell. So if this is the T helper cell, this has to be the T lymphocyte, right? So there will have to be
D.
So 76 lymphocytes.
Lymphocytes and
Antigen presenting cells, right? So this here will be the antigen presenting cell, right? And this is the macrophage. And it's also going to be found on the lymphocyte. Right, so for 76, the correct choice is D, right? Lymphocytes and antigen presenting cells, which could be macrophages, could be dendritic cells, for example, right? Those are antigen presenting cells, right? And the lymphocytes are being the T cells and the B cells. All right, 79, we're going to go with Ian.
Adaptive immunity is the result of the actions of B, T, and B cells.
Yeah, T and B cells, they make specific antibodies, right, to fight the pathogens. So 79, that is correct. 87, we're going to go with Hira.
When an antigen is bound to a class 2 MHC protein, it can activate and be CD4 T cell.
CD4, right? Yeah, CD4 T cell, right? I was just drawing it here, right? So yeah, so CD4 is going to be on the T cell. This is the receptor for the CD4. It's going to bind the MHC2, right? So, right, activated the CD4. All right, very good. 88, we are going to go with Helmi. Did I skip one? No, I didn't skip one. 88.
The cell responsible for the producing antibody molecule are antibody molecule helper T cells, C.
So the actual cells that produce antibodies, right? Remember, they were activated B cells, which were called what? Anyone remember what were activated B cells called?
Natural killer.
Lymphocyte.
Well, yeah, B cells are lymphocytes, but the moment they are activated, right? Remember, I was drawing this picture, so
plasma cell,
exactly,
plasma cells.
Right? So activated B cells are plasma cells, right? So yes, so the actual cells that actually make specific antibodies are activated B cells, which are called plasma cells. All right, 90. We have Andrew. Would you like to go for 90?
90. Which B cells are primarily activated by the activities of antibodies? B?
So B cells.
No, I'm sorry. E, plasma cells.
Plasma cells are the cells that actually produce. Plasma cells produce antibodies.
Oh, okay.
But B cells are primarily activated by what? Who activates the B cells? So these cells.
The helper T cells?
Correct. Helper T cells, right? So helper T cells will activate the B cells. So essentially, in a nutshell, right? If I went back to this picture, right, where I have it. So initially, right, let's say a macrophage comes in and it phagocytizes a pathogen or bacteria. It doesn't matter what it is, right? A foreign particle. If it didn't kill it internally, right, it's going to express it on the surface as the antigen, and it's also going to express the MHC2 molecule. It's going to take it to the T helper cell. The T helper cell is going to process it, and then the T helper cell is going to send signals to initially the B cell, and it will tell the B cell, I want you to become active. An active B cell is going to be called plasma cell. So the plasma cell is what essentially is going to start making these antibodies that are very specific, right, against that particular antigen. So this is how the process is. Macrophage will be the antigen presenting cell. It's going to go to the T helper cell. T helper cell is going to send signals to the B cell. B cell becomes active, called the plasma cell. And finally, you have the formation of specific antibodies. Could be, let's say, IgE antibodies in type 1 hypersensitivity reaction, right? So that's essentially the flow, right? So we were at number 90, helper T cells. Okay, 91, we are back to Ian.
Okay. T cells release cytokines to stimulate the activation of B cell.
B cell, correct. Yeah, so this is cytokines. So cytokines are basically intracellular messengers. They're messengers that communicate between cells, right? So we could have like interleukins that are a form of cytokines that communicate between these T and B cells, right? So 91, B is the correct choice. Very good. 92, we're going to go with Hira.
All right, 92. B cells prepare for activation by presenting an antigen bound to class 2 MHC proteins in a process called sensitization.
Yeah, sensitization is the correct choice. Yep, they activate by binding antigen, right, to class 2, right? This is called sensitization. So very good. 94. We're gonna go with Helmi. Helmi, are you here?
Sorry, my mic was off.
Okay, no problem.
Immunoglobulin that are most abundant and responsible for resistance against many viruses, bacteria, and bacterial toxin are immunoglobulin E.
So this is actually in your allergic reactions. Remember we were doing type 1 hypersensitivity reaction. So those are the most abundant in that. But the ones that are most responsible for virus and bacteria.
G.
Yeah,
I think G.
Yeah, correct.
Yeah.
Immunoglobulin G, or another name for immunoglobulins is antibodies. Immunoglobulin G is the one that's released, right, against many viruses and bacteria, right, and toxins. Okay. 95, we're gonna go with Andrew.
Hemoglobins that attach and sensitize mast cells and
Basophils.
Basophils are the IG.
The which one?
That be I think it's IgE.
IgE is correct, right? We just talked about it, right? So yeah, IgE is correct. Basophils and mast cells are usually activated during your type 1 hypersensitivity reaction or your allergic reaction, right? So this is the immunoglobulin involved. So 95, choice C is correct. We're gonna go with 113. We are Akash Deep. Would you like to do 113?
Sure. Allergen circulating in the bloodstream affects mast cells throughout the body, dropping blood pressure to dangerous low level. This response is termed anaphylactic shock.
Yeah, anaphylactic shock. And why it's a shock? Because the moment you start to drop the blood pressure, right, you have hypoperfusion to your organs, and especially if it's at dangerous low levels, right, you're going to be in a state of shock, right? So yes, very good. Next, we're going to go 115. We have, I think we're back to Ian.
Okay, auto antibodies are, I put C, directed against the body's own antigen.
Yeah, very good. So it's auto antibodies, right? They're basically the body's fighting against itself. Today I'm going to explain in the endocrine lecture, right? So especially in type 1 diabetics, the beta cells that produce insulin are being destroyed by the body who perceives those cells as being foreign. So autoantibodies, right, it's basically directed against the body's own antigens. And the body, in the case of type 1 diabetes, it marks the beta cells in the pancreas, especially the islets of the Langerhans, for destruction, right? So yes, 115, choice C is correct. We're going to go with Helmi for 118.
Blank will develop when the immune response mistakenly target normal body cells and tissue.
Autoimmune disorders, right? Very good. So yeah, so autoimmune is basically it targets its own cells for destruction. So exactly like I was giving an example with type 1 diabetes, right?
And inflammatory bowel disease too.
Yes, there's many autoimmune disease, right? Crohn's disease, inflammatory bowel disease. There's many diseases that the bodies will mark and attack itself inappropriately. Yeah, choice A is correct. So very good. 127. We're gonna go with Akash.
Okay. Explain lymphedema. I put D. Lymphedema is the invasion of red blood cell into leaky lymphatic vessels.
So think of it. What edema is? What when you have edema, it's swelling, right? So it's swelling. Usually, let's say if I tell you somebody has like pedal edema, right, secondary to congestive heart failure, let's say you will think there's fluid accumulation in the legs, pedal edema, right, secondary to heart failure. But in this case, what is lymphedema? Lymphedema is usually formed because your lymphatic system is unable to reabsorb the interstitial fluid that's coming from the capillaries, let's say, right? So if you have lymphedema, it means that the choice will be E, right? So that it's accumulation of interstitial fluid, and why that occurs, perhaps there's a blockage in the lymphatic drainage, right? Or something along the lymphatic system is not being able to reabsorb, right? So a blocked lymphatic vessel could be a reason you could get lymphedema, right? So choice E for number 127. Okay. 128, we are back to Ian.
Identify the three main classes of lymphocytes. We have T cells, B cells, and natural killer cells.
Correct. B is correct. Yeah. So T cells, B cells, natural killer cells make up your lymphocytes. Very good. And then we have Helmi for 165.
What is anaphylaxis? Anaphylaxis is a normal immune response to allergen, which is antigen and trigger and allergy reaction results from production of antibodies.
I'm like, Helmi, I could barely hear you. For 165.
I'm reading the answers.
Oh, okay. Okay.
Anaphylaxis and
no problem.
immune response to your problem with anaphylaxis is an immune response. Well, the answer will be D.
D? Yeah, D is correct. So anaphylaxis is an immune response to a circulating antigen that stimulates mast cells throughout the body to release chemicals that prompt the inflammatory response. So mast cells will degranulate, right, releasing histamine. Histamine will cause, it's a spasmogenic. It's going to cause more leaky vessels, right? So you have edema formation, right? So that's what we talked about throughout the lecture. So for number 165, D is the correct choice. I think that's the last question in the problem set. Anyone has any questions about any problems in this problem set?